Do you have water stool, stomach ache, experiencing nausea, vomiting, fatigue, and headache? It is often experienced by people who is suffering from diarrhea. It is an increase in the frequency of bowel movements or a decrease in the form of stool. Watery stools occurring more than 3 times in one day, and common problem that usually lasts a day or two and goes away on its own without any special treatment. Diarrhea strikes all ages at one time or another. On average, adults can experience diarrhea as many as 4 times per year. Diarrhea may be caused by a temporary problem like an infection or a chronic problem like an intestinal disease. A few of the more common causes of diarrhea are bacterial infections, viral infections, food intolerances, parasites like Giardia lamblia, Entamoeba histolytica, and Cryptosporidium, reaction to medicines, intestinal diseases, and functional bowel disorders. Diarrhea may be accompanied by cramping abdominal pain, bloating, nausea, or an urgent need to use the bathroom. Depending on the cause, a person may have a fever or bloody stools. Diarrhea can be either acute or chronic. The acute form, which lasts less than 3 weeks, is usually related to a bacterial, viral, or parasitic infection. Chronic diarrhea lasts more than 3 weeks and is usually related to functional disorders like irritable bowel syndrome or diseases like celiac diseases or inflammatory bowel disease. Infection with the rotavirus is the most common cause of acute childhood diarrhea. Rotavirus diarrhea usually resolves in 5 to 8 days. Diarrhea can be dangerous in newborns and infants. In small children, severe diarrhea lasting just a day or two can lead to dehydration. Diarrhea can cause dehydration, which means the body lacks enough fluid to function properly. Dehydration is particularly dangerous in children and in the elderly, and it must be treated promptly to avoid serious health problems. If your child has diarrhea, do not hesitate to call the doctor for advice. Diarrhea can be dangerous in children if too much fluid is lost and not replaced quickly. Medical history and physical examination, stool culture, blood tests, fasting tests, sigmoidoscopy, and colonoscopy.
Diarrhea, diarrhea.
With diarrhea, the most important action is to replace the fluids and electrolytes that are lost when you pass excess water in your stool. This will help to prevent or relieve symptoms of diarrhea as it runs its course. It is important to drink plenty of water, clear sodas, herbal teas, and broths. You should avoid coffee and alcohol. Avoid greasy, fibrous foods and things that are very sweet. Try not to drink dairy products as this may aggravate your diarrhea. Stick with mainly a liquid intake and gradually return to soft food like plain rice, baked skinless chicken, and bananas.
When your butler's a beef stew, diarrhea, diarrhea. When you're playing with your junk and your ass starts blowing chunks, diarrhea, diarrhea. Diarrhea is the best when it's rolling down your chest, yeah. Diarrhea's kinda nice when it's filled with cheese and rice, and everybody wants some diarrhea in their life. Diarrhea, diarrhea.